Master of multitasking inside the human body, and there are two of them. Oh, I know, it's kidneys. For humans, they are essential to survival. They are the small biological marvels. They produce urine and removes extra water and toxins. Kidneys are busy doing many tasks. They are constantly removing waste products from the blood and balancing the salts, acids, and water levels of our body. They work with the brain and heart to control our blood pressure. They help to manage vitamin D and calcium to keep our bones strong and help in process of making new blood cells. Many things can damage the kidneys. Acute kidney failure or acute kidney injury is the sudden short-term loss of kidney functions. But if not stopped or reversed, it can lead to the chronic renal failures. When the damage is very fast and sudden, which is also called acute kidney injury, this can become a serious problem and needs a quick attention. The buildup of acids, chemicals and waste can be very dangerous. It's important for us to know what causes the acute kidney injury, what are its symptoms, how it is diagnosed, how can we prevent it and treat it. Our kidneys are made up of millions of tiny tubes called nephrons. These are like filtration plants that cleans the blood and maintain the right level of fluid, acids and salts for our body. Different things can damage the nephrons and kidneys. So it's important for us to know what is the correct understanding. And the answer is sudden loss of kidney function due to the loss of renal, systemic circulation, or glomerular or tubular damage. So what's really going on in our body? For pathophysiology and causes, let's cover the acute kidney failure first. In acute kidney failure, it can result from the three types. We have pre-renal, which decreases the blood flow to the kidney. And the next is intrarenal, which damages inside the renal. If the cause after renal, that's post-renal. So just think, let's dig into the specifics here. This decreased blood flow means decreased oxygen. So no oxygen and body goes broke and die. Kind of like kidneys suffocated to death. Now, this is typically caused by an obstruction or a vessel occlusion where we have a blockage of blood flow which blocks the oxygen. Now, this is typically from an emboli or a blood clot or even a tumor that blocks the perfusion into the kidneys. Another cause is from the low blood pressure, that low perfusion with the pre-renal. Lastly, low cardiac output. We get low perfusion. So just think, low cardiac output means low oxygen put out of the heart, resulting in the low perfusion to the kidneys, typically from where the heart can't pump correctly. We get the low volume of oxygen-rich blood out of the heart. This results in the less perfusion and less oxygen to the kidneys. Now we have the intrarenal, which is a direct damage inside the kidney itself. Now it's also referred to as ATN, acute tubular necrosis, which is typically caused from the infections resulting from the nephritis or even on autoimmune disease like lupus, where the body attacks itself, resulting in the nephrotic syndrome. Creatinine over 1.3 is a bad kidney. Just think of the 3 C's. Creatinine is the most critical lab value since it shows clogging of the blood. And at last but not the least, we have the post-renal. There's a renal blockage of the 2 kidneys, which basically blocks the outflow of the urine. So urine can't get out of the kidney itself, causing a lot of pressure, pain and strain on the renals. Clients with renal calculi or even a tumor or even a BPH, benign prostatic hyperplasia. We see a big swollen prostate in our older men population assessment findings. What are the 3 waste products that the kidney filter? H is for the hydrogen ion, which is very acidic. U is for the urea. C is for the creatinine. Creatinine over 1.3 is bad kidney. 1 over 20 is very bad. Urine output 30 ml per hour or less means kidneys are in distress, and metabolic acidosis is pH below 10.35. What are the symptoms of acute kidney failure? Which includes fatigue, confusion, too sleepy, somnolent, having trouble with passing urine, making less urine, having a dark color of urine, nausea, or even a shortness of breath. Now, if you're diagnosed with the acute kidney injury, many questions are there to ask. and determine the cause. These questions might include: what medical conditions do you have? What medicines do you take? Did you start any new medicines, substances, or even supplements? How many urine are you making? Do you have any abdominal pain? Or is there any difficulty in passing the urine? How much water have you been drinking? Or any of the new symptoms you have been experiencing? So based upon the results of the blood test, a renal function test helps to check the level of the creatinine and urea and burn in the blood. Based upon the history and the blood test, further tests are usually needed. These may include more blood tests, urine tests, an ultrasound, CT scan of the abdomen. These tests will guide the treatment plan for your condition. In rare cases, a biopsy of the kidney may also be needed for the diagnosis. Treatment usually require IV medications and at times urgent dialysis. Some people may have IV fluids for rehydration, procedures to remove the blockage in urine tubes. Some may need to stop using medicines or substances that led to the damage, and for some, they need medicines to treat their conditions. Many times the recovery is very slow, keeping a slow follow-up with the doctors, and be careful. The prevention. These are the key elements of the patients for someone who is suffering from the acute renal injury, which include correcting the fluid, electrolyte disturbance, treating infections, maintaining nutrition. Safe hygiene practices are also required. Thanks for watching.